Hello and welcome again, everybody. This is another group presentation. This is a good one. Talk about Medicare and Medicaid. It's one of those important things that people generally know a bit about, but maybe not a ton. And you're going to see this type of topic come up on your quizzes throughout the remainder of this class. So you want to pay careful attention, have a good idea of the differences between the two, the different types there are, all that stuff too. So Fernanda and Jocelyn will cover it really well. I'll go and turn the time on over to you two.
Perfect, thanks. So my name is Jocelyn Sanchez and my partner's name is Fernanda Ballers. We are Group 8 and today's presentation will be on CMS, Medicare, and Medicaid. So yeah, next slide. So the first thing we want to talk about is Center for Medicare and Medicaid Services. It was originally formed in 1965. And it was previously known as Healthcare Financing Administration. It administers Medicare program. It works in partnership with state governments to administer Medicaid, state children's health insurance program, and health insurance portability standards. So it is responsible for administrative simplification standards from HIPAA, quality standards in long-term care facilities, clinical laboratory quality and standards, and oversight of healthcare.gov. So, next slide.
So I'll be talking a little bit about Medicare, actually quite a bit, but the program started in 1965 under the leadership of President Lyndon Johnson. It was enacted by Congress under Title 18 of Social Security Act to provide health insurance to people age 65 and older. Over the past half century, the program has undergone several changes, including the expansion of coverage for different medical benefits, the addition of coverage through health maintenance organizations, expansion of eligibility to younger people with permanent disabilities, the inclusion of a drug coverage program, and the addition of coverage of hospice benefits. Next slide. Next slide. We can go on to the next slide, Brother Gage.
Brother Gage. Are you there?
He muted his microphone. I wonder if he can hear us. Nope, we dropped.
Oh, okay. Well.
Hi, can you guys see me? Hear me?
Hi, yes.
Sorry, that was my fault.
That's all right.
Let's see here. Okay, can you guys see the PowerPoint now?
Yes.
Okay, sorry everybody, and let's see, I'm a little worried. Present to everybody. Okay, I think that should do it now. I apologize. You can go and pick up where you left off.
Okay. I finished this slide. I guess we can go ahead and yeah, there we go.
Thank you. Sorry, guys.
Medicare has 4 main components, Part A, B, C, and D. Part A is what's called hospital insurance. It covers inpatient hospital stays, skilled nursing facilities, and hospice benefits. Part B is the medical insurance part, which covers 80% of costs from service not covered by Part A, mostly on an outpatient basis. So doctor's visits, x-rays, laboratory and diagnostic tests, medical treatments done at doctor's offices, vaccinations, among others. It's an optional part of, it's an optional coverage, and usually is deferred if beneficiary or the beneficiary's spouse still works and has insurance through their employer. Next slide. Part D is the prescription drug insurance, and it covers most prescription drugs, though some are still covered by Part A, the medical insurance. And Part C is Medicare Advantage plans. That card on the top right is an example of that. Basically, beneficiaries receive Part A, B, and D benefits through a public supplement option of Medicare coverage. This represents almost 32% of all Medicare beneficiaries, and beneficiaries with this type of coverage cost the trust funds about 5% less than those with traditional Medicare coverage. And next slide. Beneficiaries, people that are over 65 years of age, and they must be a legal resident of the United States for at least 5 years or a U.S. citizen to qualify for Medicare. People with disabilities that are under 65 years, and if they receive Social Security disability insurance benefits, also qualify. And people with special medical conditions also qualify for Medicare. It doesn't matter their age. Some beneficiaries are what's called dual eligible, which means they qualify for both Medicare and Medicaid. Next slide. There are three main issues with Medicare: fraud, abuse, and funding. Next slide. The first one is fraud, and basically anyone can commit healthcare fraud. The schemes range from solo ventures to broad-based operations by an institution or a group. It would typically include false claims or misrepresentation of fact to obtain payment, paying or receiving payment from referrals for items or services reimbursed by Medicare, or making prohibited referrals for certain health services. Next slide. Some examples are billing Medicare for appointments the patient failed to keep, billing for services at a level of complexity higher than services actually provided or documented on file, and knowingly billing for services not furnished or supplies not provided, or both, including falsifying records to show delivery of such items. Next slide. Another issue is abuse, and basically it includes any practice not consistent with providing patients with services that are medically necessary, meet professionally recognized standards, and are priced fairly. Next slide. Some examples include billing for unnecessary medical services, charging excessively for services or supplies, and misusing codes on a claim, such as upcoding or unbundling codes. Next slide. And lastly, funding. Over the long term, Medicare faces significant financial challenges because of the rising overall health costs, the increasing enrollment as the population ages, and the decreased ratio of workers to enrollees. I read that between 2010 and 2030, that's the time when the baby boomer generation is gonna be enrolling for Medicare. That's when they get to the 65 years of age. And so the enrollment population is gonna increase a lot within this time period. There are two main things also with funding, which is the date of insolvency of the AGI fund, which will be discussed in a little bit, and the expected increased demand on federal budget resources are also Medicare issues. Next slide. So Medicare is funded from three main sources: general revenues, which constitute 42%, payroll taxes, 37%, and beneficiary premiums, 13%. Next slide. There are two main trust funds that pay for Medicare in general. The first one is the Hospital Insurance, or HI Trust Fund. It is funded by payroll taxes, income taxes paid on Social Security benefits, interest earned on trust fund investments, and Medicare Part A premiums. And it pays for all the benefits from Medicare Part A. It also pays for Medicare program administration costs, like costs for paying benefits, collecting taxes, and combating fraud and abuse. The other trust fund is the Supplementary Medical Insurance Trust Fund, the SMI. It is funded by government funds authorized from Congress and Medicare Part B and D premiums, and interest earned from trust fund investments. It also pays for Medicare Part B and D benefits and Medicare program costs, administration costs. Next slide. Medicare Trust Fund's bankruptcy. So in regards to the Hospital Insurance Trust Fund, we talk about insolvency and not necessarily bankruptcy. But each year, the Medicare trustees provide an estimate of when the assets available in the main trust fund, which is the HI Trust Fund, would be exhausted by the payments made from it. 28. Brother Gage? The slides are gone.
They're gone again.
Yeah.
Let's see. What do you see?
I just see like your picture, the HS picture.
Okay, let's see here. I'm sorry, I do not know what's going on. So screen, present to everybody. Still nothing?
No.
Let's try it this way here. Present.
I can try and pull it up on my screen if that would help.
Are you able to share your screen? Is there an option for you to do that? I keep clicking. Stop screen sharing. Stop presenting. Share screen. Share two. And present to everybody. Nothing still?
No, just your picture. I don't see an option for us to share our screen here.
Okay. I wonder. Sorry, you guys were doing so well with it. I don't know why all of a sudden went all.
Actually, I found here a screen share button. Do you want me to go ahead and share mine with the?
Let's give it a shot. Sure.
Okay.
So usually you share your screen and then you present to everybody.
Can you see that?
I can see it in your little window, but that's.
Yeah.
Oh,
Let's see. Present to everybody. Let's try it. Anything now?
This is sort of popping up.
All right. I think maybe what we can do So you guys are on slide 15 of 23. What I can do is when we attach this for your group to see, or for everyone, all the other classmates to see, I'm going to have them open it up, do an attachment of the PowerPoint slide, and just follow along as you do the audio part. Are you okay with doing that?
That's fine. Yeah.
Okay, so are you guys able to pull up your PowerPoint or at least see it currently?
Mm-hmm.
Yeah.
All right.
Okay, can you see from mine, or do you want to pull up yours, Jocelyn?
I have mine pulled up. Thank you.
Okay. So,
I think we're on you were ending slide 15.
Yes. We're talking about 2016 estimates will be 2028.
Which is in 12 years. At that time, the HI, the Hospital Insurance Trust Fund, would continue to receive tax income from which some benefits could be paid. However, funds would be sufficient to pay for only about 87% of Part A expenses. Currently, there are no provisions on the Social Security Act that govern what would happen if insolvency were to occur. So government will have to basically figure out what to do to pay for the other 13%. On the next slide, it's talking about the trust funds, possible bankruptcy for the SMI trust fund, which is that secondary trust fund. Part B and D do not have financing challenges similar to Part A, because both are funded by beneficiary premiums and general revenues that are set annually to match expected outlays. So the expected future increases in spending under Part B and D, they will require increased general funding from government and also higher premiums paid by beneficiaries. So this specific fund couldn't go bankrupt, but it will also cost more to the public and to government. That's it for Medicare.
Perfect. So Medicaid history, there's a little bit about it. It started in 1965. It was created by the Social Security Amendments of 1965 under the title number 19 of the Social Security Act to provide health care insurance to those with low-income households. Now, this was done also under President Johnson. So over time, Medicaid has greatly expanded to help several people. With our previous president, Barack Obama, Medicaid had the opportunity to expand a little bit with Obamacare. Now, just in 2015, over half of the states expanded in Medicaid. So Obamacare expanded Medicaid to open up for people with income up to 133% above the poverty line for qualification. So next slide. Some of the beneficiaries of Medicaid are people with low income. Again, it must be under that percentage or below the poverty line. This group of people is limited to be low income earners below the age of 65. And both children or adults making this percentage or less below the poverty line can qualify for Medicaid. Supplemental Security income members also qualify. And in some states, the blind, aged, or disabled qualify at times. Also, to be a beneficiary, you have to be a U.S. citizen or a legal permanent resident. So the next slide. Some of the rise with Medicaid is sometimes the doctors do abuse Medicaid by billing extra. In Gwinnett, Georgia, there was recently a case in February where a dentist office overbilled Medicaid for about $1 million. I believe it was saying that they are probably going to jail for about 10 years for that. There is a limited amount of participating organizations accepting Medicaid. So that does make it a little bit difficult for those who qualify for Medicaid to get to organizations that would, I guess, accept it. So some income earners do sometimes get low-paying jobs purposefully to get Medicaid, which takes away from those who actually need it sometimes. So the next slide, it says, it's talking about how Medicaid is funded. Now, Medicaid is funded primarily by two sources, which are the states and the federal government. So Medicaid makes up to 24.5% of all states and federal funds spent together. And just in state funds, that's 17.8% of it that's spent. And then a total of 47.6% of it is federal funds spent on it. So these numbers are just based off of 2014 numbers. So the next slide just has our resources where we were able to find all our information, if any of you want to take a look at those. And we really hope you enjoyed our presentation. Thank you so much, guys.
Thank you to you too. I actually really did enjoy it. Sorry about the technical difficulties. I'll take full blame for that. I'm not exactly sure what happened, but I'm sorry about that. But you rolled with the punches very well, and you did a really good job. I appreciate your preparation and presentation that you did. So very good. Let's just open things up real quick with a quick question and answer. I won't put you through too much of a ringer since I messed up with the technical side of it all. But I would like to hear from each of you. What's one thing that stood out to you as you were studying, like the most surprising thing or the biggest thing that stood out to you when you're studying up on, you know, Medicare, Medicaid, or the CMS as a whole?
Well, as far as on my side, the Medicaid part, it was a little surprising to me about the doctors abusing the Medicaid and billing extra. It was also, I mean, it was always something I had sort of heard about, but it was just surprising that that actually happened and is still happening. So, yeah.
Okay. How about you, Fernanda?
I think I worked at a doctor's office for about 2 years, so I got used to a lot of the Medicare part of it. And I think that the one part that surprised me the most was like the funding behind Medicare, and how they spend the funds. Like part of it is divided for the hospital, you know, just Part A benefits, and you know another fund is completely separate for the Part B and D benefits. I was just surprised at how complicated it can be for all that funding, and with the coming years, what we're going to have to, not we, but government itself will have to do to figure out how to keep that going with the amount of beneficiaries increasing and the amount of workers paying into like funding the program, how that's going to be solved so that, you know, the program doesn't go bankrupt. And so that was the two things that were more surprising to me.
Well, good. I think both those are really good points. You know, Jocelyn, speaking to you, to your point, you do hear a lot about Medicaid abuse, and a lot of times you may hear it from the patients who are abusing it, but it's important to know that on the physician side that there's a lot of, I'll just say, opportunity for them to abuse it as well. And what you'll find is there's an increasing trend that as certain physicians become more established in their community or whatever else, they're less likely to take on Medicaid patients because they only get a portion of that payment. They don't get as much as a full insurance or a self-pay type of patient. And so they may not be as happy about treating all these Medicaid patients. It may lead to fraud. It may lead to care that's not quite as good. All these little things, and that falls into the category, just like you were saying, of some type of abuse of the system from the physician's side. And Fernanda, to your point, I think that is a real fear that people have. You know, you hear about the baby boomers, and as they're getting older and older, well, they're going to be taking over retirement. They're going to be taking over Medicare, all these different things. And the question is, for you young people, because I'm getting old too, so I'm talking to you young people, the question is, how's that going to be for you once you are needing to draw Social Security or needing to take care of some Medicaid, all that stuff? Is the money going to be available to you because these baby boomer people are getting much older and they're getting to the point where they need that additional care and the additional funding? So very good points. Like I said, a great presentation. You should feel good about the work you did, and thank you for that. Is there anything else either one of you would like to share before I let you go?
No, I think that's it.
All right. Well, again, great job.
Thank you.
Yeah.
Thank you.
Enjoy the rest of your day.
You
Thank
too.
you as well.
Thank you. Sorry, everybody, for the technical issues. I think hopefully we're able to see Fernanda's slides as she went through with it. If not, I'll post their PowerPoint slide for you to kind of go through as they talk about it too. So thank you. We'll talk to you guys later.
Thanks.